I got started in the medical profession because actually my grandmother was a nurse and I kind of admired the qualities. It was something I was always interested in. I think Riverside as a whole is like a family. The collaboration between myself and the other providers here is an awesome experience. It's a very supportive environment. We do have a lot of resources, which makes it convenient for the patients. We have an in-house lab that we can direct patients to. We treat a lot of things, a lot of chronic conditions. Some days like diabetes, hypertension. Other days are wellness visits when they're just coming in for things such as a physical exam or something they require for their insurance. A patient that comes through the door of Riverside, they're going to get quality care. Their best interests are the reason that we do what we do. The value of open communication is very, very important between a provider and a patient. It is always my goal to do things with my patients in mind, meet them where they are. The Riverside mission is to care for others as we would care for those we love. I think that's an important tenet. I think it keeps you grounded. I think it's a tenet that's lived. It's not just talked about. It's something that they embody. I am Beverly Brown, nurse practitioner with Riverside.